Hello, I'm Dr. Sudeep Koshy, Kurien, Interventional Cardiologist. I'm going to tell you a true story which happened a couple of years ago. One Sunday morning after a heavy night's duty, I was at home, I got a call from my friend's wife telling that he is having chest pain. I told them to go to hospital and take an ECG immediately. And it was conveyed to me that he has a major heart attack. I asked them to shift him to the hospital where I'm working, and I got the cath lab ready because he had a blocked artery which needed to be opened. So they got into ambulance and I was waiting, and then I got another call, and all I could hear was wailing and loud noise. My friend had cardiac arrest inside the ambulance. His wife and children were panicking, and I was also panicking. I didn't know what to do to help them. So I told them to do CPR, cardiopulmonary resuscitation. They didn't know what CPR was. So here I was frantically trying to tell them what to do, and they couldn't do anything. I asked them to take him to the nearest hospital on the way, and he was wheeled there. I called the hospital there and I made arrangements there, and me and my wife, we reached that hospital. Everybody tried for 45 minutes, but we couldn't save him because the golden minutes had passed away and he could not make it. This true story conveyed two things. One, the inability of the patient and the relatives to understand the seriousness of the situation and to understand that these symptoms were related to heart. Number two, when somebody had a cardiac arrest, the people around did not know how to react to the situation. How do you know that you're getting a heart attack? The main thing is the type of pain. In a heart attack, you have a crushing pain in the left side of the chest or the central chest region, radiating to your arm or the jaw or even the back. You'll also have associated symptoms like breathlessness and sweating, severe or profuse sweating. Sometimes you will have only mild symptoms, but it'll be different from what you usually had. And most of the people mistake it for acidity. The clue here is that if you have something which is unusual from what you experience, then you should take seriously. What to do when you're suspecting a heart attack? The first thing you do is call for help. The second thing is that you don't do anything which puts strain to your body. You don't move around. You call for help, and then you go to the nearest hospital, see a doctor, and take an ECG. This is the first thing you should do. A heart attack is when one of the arteries which is supplying the muscles of the heart gets blocked, and that area slowly dies. And when you open that artery in time, you save muscle because time is muscle. So you'll have to get to hospital where there is a cath lab facility as soon as possible. Whereas a cardiac arrest is when the heart stops completely as a result of a heart attack. It can be due to other reasons also. So when you have a cardiac arrest, the heart stops. The heart has to be revived. So in this case, where it was just a transport ambulance, where the facilities was not available and trained personnel was not available, the bystanders had to do the cardiopulmonary resuscitation, which they were not trained for. And that's the unfortunate part of the story. And the family lost a loving father, a husband, and I lost my dear friend. This is why knowing CPR or cardiopulmonary resuscitation is so important for all of us, because we don't know when the time comes to use that. You may save a life.